Welcome back to Africa 54. I'm Vincent McCory. Now, do you know your HIV status? Well, a new test can provide an answer in just seconds. In tonight's Health, we have two reports on combating AIDS, beginning with VOA's Bernard Shusman in New York.
New York was one of the first major cities in the United States to be hit by the AIDS virus in the 1980s. Since that time, treatment for the disease has been getting progressively better. In this public setting off a busy New York street, a mini laboratory is providing free testing all day for the HIV virus. Its health workers say it is non-intrusive and easy.
So the test is very simple. It comes in this packet. It's pretty straightforward. There's no blood involved.
In New York City, 1 in 5 people who have the HIV virus do not know their status. So that's why the community has set up these mobile laboratories. The test takes seconds. The results are back in about 20 minutes.
So with this top part, you're going to slide it across your gums, back and forth, and then you would do the same thing on the bottom, like if you're brushing your teeth.
This is all part of a community healthcare network program to not only test, but to educate and provide some preventative measures. Despite all the progress, media program manager Diana Diaz says HIV is still a big problem.
HIV is still increasing. Although we've gotten an increase in terms of medications, the availability of care, even insurances, we still have a new number of patients. We have an increase of maybe about 8% every year.
Diaz says 90% of all new HIV cases among women in New York are either African Americans or Latinos. Almost 4,000 New Yorkers will be infected this year, which is good reason, according to the City Health Department, to test. To date, more than 100,000 New Yorkers have died from AIDS-related causes. Bernard Shusman, VOA News, New York.
Well, now to South Africa, where health officials are promoting circumcision to reduce new HIV infections. Researchers have found that circumcised men are twice less likely to contract the virus. We get more from Emilie Iob in Johannesburg.
Each day, dozens of men pass through the door of the circumcision clinic in the south of Johannesburg. But before any surgery, all patients attend a counseling session to be briefed on the protective impact of circumcision. Abel, 17 years old, came with his brother.
Protects from AIDS.
It does to a certain extent. Circumcised men are twice as likely to be infected by HIV than those who are uncircumcised. So clinic's medical staff counsels these men to also use condoms. The protective effect of circumcision was confirmed through clinical trials about 10 years ago, prompting the WHO and local governments to launch massive circumcision program in 14 priority countries in Africa, which represent 50% of all AIDS cases. After counseling, men are offered an HIV test, since UNAIDS estimate more than half the people living with HIV are not aware of their status. Then comes the surgery, which lasts 5 to 7 minutes and is pain-free, says general practitioner Dumisani Mshlambi.
All they're scared of, all they're thinking of is pain. Is there going to be pain inflicted more than anything else? 99.4% we do render pain-free services to a certain extent.
The Bopelo Pele Clinic in Orange Farm was the first circumcision center to open in South Africa in 2007. Awareness campaign seems to be working in this neighborhood, where more than 80% of men are circumcised, compared with less than 20% 7 years ago. Dozens of other centers have since opened across the country. Male nurse Mandizi Mfwaze says social norms have shifted over the years.
It's actually, now if you are not circumcised as a young man, you are most likely will be, some guys will laugh at you. So people come also because of peer pressure, not only because of them HIV and AIDS reasons, but it is beneficial to them at the end of the day.
CHAPS, the Center for HIV and AIDS Prevention Studies, which manage the clinics, continue to study the impact of the circumcision. CEO Dirk Taljart says new data suggests circumcision benefit women too.
Lastly, we saw a protective effect for women already. So if you have women in the community that have only had circumcised partners, their risk was reduced already by about 20% from 15 to 25-year-old women.
It is estimated that in South Africa, for every 4 circumcisions done, 1 HIV infection is avoided. Since 2007, more than 1.5 million circumcisions have been performed and possibly close to 400,000 new infections have been avoided. Emilie Iob for VOA News, Johannesburg.